Adolescence is a crucial phase where mental well-being plays an important part in shaping an individual's future. However, the mental health concerns among adolescents always mostly go unoften noticed and or misunderstood. Through this webinar, we aim to break myths, address challenges, and discuss effective strategies for supporting young minds. This webinar is proudly organized by CGAHA 2025, and we are privileged to have experts in the field with us today. Before we proceed, I would like to extend our heartfelt gratitude to esteemed leaders and experts gracing this occasion. Dr. Vasant Khaladkar, President, Central IAP. Dr. Yogesh Parikh sir is with us today, Honorable Secretary of Central IAP. Dr. Atnu Bhadra, Treasurer, Central IAP. Dr. Neelam Mohan, President-elect, Central IAP. Dr. Basav Raja, immediate past President, Central IAP. Dr. Him Bindu Ma'am, past President, Central IAP. Dr. Geeta Patil Ma'am, Chairperson, Central AHA 2024. Dr. Shushma Desai Ma'am, Chairperson-elect AHA. Dr. KP Sarabhai Sir, Executive Board Member, Central CGAP. Dr. Rakesh Padal Sir, President CGAP. Padma Shri Dr. Pukhraj Bhakna Sir, Stalwart of CGAHA. Dr. Madhushi Deshpande Ma'am, Founder Chairperson of CGAHA. Dr. Sukanta Chatterjee, Past President, Central AHA. We are glad to welcome our chief guest, Dr. Amar Singh Thakur Sir, and our guest of honor, Dr. Anoop Verma Sir. I also welcome senior pediatrician who has joined us today, Dr. Kiran Shankar Devraj Sir, Dr. Chaudhary Sir, and I extend my warm welcome to Dr. Arvind Sawant Sir, Past President CGAHA 2024, and Dr. Ashok Mehta Sir. We are delighted to have all of us today. So I now request Dr. Sangeeta Joshi, Chairperson CGAHA 2025, to deliver the presidential address.
Yeah. Good evening, respected dignitaries on and off the dais. On behalf of CGAHA, I, Dr. Sangeeta Joshi, welcome you all for second webinar of our series, Begin with Basics. And today, the topic is mental health. It is unfortunate that we are getting mental health issues more commonly in our adolescents, but they are less diagnosed, partly because of taboo in society and partly because non-acceptance by the parents. But we, as a pediatricians and primary healthcare providers, it's our responsibility to diagnose such cases and help them. To enlighten us on this topic, we have stalwart of AHA, Dr. Geeta Patil ma'am, and I am sure at the end of today's lecture, we are going to be wiser. I again thank all of you for joining us and making this event successful. Over to you, Dr. Akanksha, for proceedings. Thank you. Dr. Akanksha?
Am I audible?
Yeah.
Now I request our seniors to speak few words. I request Dr. Yogesh Parikh sir.
Good evening, all the respected seniors and dear colleagues. Very warm welcome to all this important topic of the AHA and on the adolescent mental health. So in absentia, our President, Dr. Vasant Khaladkar ji, Dr. Neelam Ben Mohan, Dr. G. Baswara, Dr. Atnu Bhadra, and all the leaders of the AHA here, Dr. Hema Bindu Madam, Dr. Shushma Desai Madam, Dr. Geeta Patil Madam, Dr. P.V. Arya Sir, Dr. Sneha ji, my EB colleagues and seniors, Dr. K.P. Sarbai, Dr. Rakesh Patil ji, Nilay, Geeta Patil Madam again as a chairperson and the speaker, guest of honor, Dr. Anoop Verma ji, Dr. Amar Thakur sir, and chairperson, Dr. Phuljhale Madam, and Chhattisgarh AHA President, Sangeeta Joshi Madam, Dr. Nitika, and Dr. Akansha. So this is a very important topic today you have selected for this wonderful evening, and we all know the adolescent health is a very important in and it is our responsibility to address the such profound importance of the adolescent mental health as a adolescent is almost a transformative phase by the physiology, by the psychology, and by the social. So it is also a period fraught with the challenges from the academic pressure and identity exploration to navigating the relationship in increasing the digital and the complex world. So these experiences shape their mental health and often having a they're leaving them some dedicated crossroad, and for too long the stigma surrounding mental health that Dr. Sangeeta Madam told has almost in the conversation with the silence. There are some misinformation from the peer pressure, misconception by the reading some books or Googling or the social media, and how they have so many amplifying of the challenges. So to prevent this from all, we have to, yeah, from our young people from seeking the support they deserve. So today, Dr. Geeta Patil Madam here to unravel this misconception and the demystifying adolescent mental health. So I think first and foremost, mental health is not only binary, but there is a no normal versus abnormal. So instead, it exists on the continuum affected by the genetics, environment, and social norms and the personal experience. Adolescent in particular requires supportive ecosystem and nurturing environment where they feel seen, heard, and valued. So education is only the key, and it is a cornerstone of these efforts. So parents, teachers, healthcare professionals, providers, and the community leaders must be equipped with all these identifying early signs of the mental health. Stigma and whatever bullying in the schools or the colleges or any issue. So I think our experts of the adolescents will have a great role for this all. And our seniors like Dr. Pukrat Bapna sir here, Dr. Sukanda Chatterjee, and Dr. Kiran Makhija, Dr. Amish Kurana, all are here with the AHA leadership, and they will play the big role and lead AHA and for the educating and creating awareness like our IP के बाद community के साथ program. So thank you very much for inviting and giving opportunity to address all of you. Thank you once again, and over to you, madam.
I welcome Dr. Shushma Desai, ma'am. She has joined us now. Welcome, ma'am. Please, Dr. Hima Bindu, ma'am.
Yeah, a very good evening, Akanksha. Thank you for inviting the Central AHA leadership here. I would acknowledge the presence of IAP leadership, Dr. Yogesh Parekh, and all the others. And of course, our Central EB member from Chhattisgarh, Dr. Sarabhai, and Dr. Anoop, and Dr. Purana sir, Dr. Pukraj Bafna sir. Many stalwarts are here, Dr. Madhushri madam, Sharja madam, and Kiran Makhija. Kavita, Nitika Jain, who's the office bearer, along with Sangeeta Joshi, is doing an excellent job by selecting the topics which are very, very relevant. So I bring greetings from Central AHA and acknowledge the presence of Dr. Geeta Patil, our own past chairperson, and of course Sukanta sir here. This is a AHA is really we are under 13, 14 branches which are we're still widening up. We are trying to create more state branches, and through our state branches, these are actually a backbone for us. So state branches and other branches, they will take over. They are more closer to the community. Our central AHA action plans are there, and we request all of you to kindly carry on these programs along with your own programs elected. So this will be cascading down through you, all the state branches. So all the members are so active in AHA. I really request under the blessings of our Pukraj Bafna sir and all seniors there. I wish Chhattisgarh Academy of Adolescent Health will progress into more of community work along with the academic webinars. And I wish you all the best. Very, very apt topic. this topic. We have been learning so much on mental health, but unfortunately, we didn't have a formal training. And AHA, under the leadership of Dr. Geeta, last time we have applied for a course on mental health, and which it is already approved. And maybe if you want a structured training, we can do that. Also, we have an opportunity, and we also would like to conduct adolescent counseling webinars as a course through AHA. So this will empower our pediatricians to be able to guide the adolescents and parents in a right way. So this is our commitment from the AHA side, and all the very best for this webinar today. A right person chosen for the right topic. And welcome Anoop Verma ji also. Thank you.
Thank you, ma'am. Let's welcome Dr. Geeta Patil, who is the speaker for the session, to share a few words.
Should I start my session?
No, ma'am. Just few words.
I think I congratulate Chhattisgarh AHA. Last year also, it was done so well. Counseling sessions were there. So instead of talking, I think at the outset, let me thank Central IAP represented by Yogesh Parikh sir. He is a AHA member for many years and he has done a lot of work. I think now he is busy as an honorary secretary, but we have known him that he was associated with AHA work from a long time, because his work and his photos are there, documentation for us. And apart from that, Central AHA Chairperson, Dr. Himabindu Madam, Chairperson elect, Dr. Sushma Madam, and whole team of AHA, and Chhattisgarh AHA led by Dr. Sangeeta, Dr. Nitika, then Dr. Akanksha, and our it shows that Chhattisgarh IAP also is supporting Dr. Rakesh, Dr. Neelay, and Chhattisgarh Central IAP EB. Dr. Sarabai sir is also there with us. And our Dr. Anoop Verma sir, a very learned academician who is going to be there. And our expert, I think I don't have anything to tell about Amar Singh Thakur sir. He knows many things and there are a lot many experts when I am going to talk. Sukanta sir, Sukanta, who was a past chairperson of AHA. Mental health is his strength. Dr. Sushma Desai madam, she is also there. Himabindu madam is there. Madhushri Deshpande, who has done a lot of work. So I think I don't want to waste my time. And then first thing, pranam to Dr. Pukraj Bapna sir. Sir is here and sir has taught us many things, mental health and relaxation techniques. Sir is the one who can tell us many things. And madam who is going to be chairperson, she Sharja phuljhale madam. I thank everyone for giving me opportunity. I'm representing AHA. This topic, when I start talking, I will tell about other things. Thank you very much for giving me opportunity. I think Sushma madam is there. I think instead of me, you could have told Sushma madam. Sushma is there? Sushma Desai?
Hello.
Yeah,
Am
yeah.
I audible?
Yes,
Am I audible?
yes, Sushma ji.
Yeah. It's good evening all, and it's always a truly a pleasurable occasion every time whenever I get united, whether virtually or physically, with the Chhattisgarh team. And first of all, I would like to thank all the CIP representatives, especially Yogesh Bhai, as a very a very aptly pointed out by Dr. Geeta Patil. Is such a supportive man and always supports all the activities of AHA. So I look forward to have you always, sir, with us. I'm so very happy to see respected Dr. Pukraj Bapna sir, our AHA chairperson, Dr. Hima Binduji, and Dr. Geeta Patil madam, all the stalwarts of Chhattisgarh AHA and Chhattisgarh IP. The topic, I think Chhattisgarh AHA is always choosing all the webinars and the topic, the theme, always in a very thoughtful manner. We have seen the counseling series, and now today's topic is truly aptly chosen topic. We all know more than 40% of the mental health, serious lifelong long mental health issues, they have an onset in adolescence. there are lots of myths and of course the reservations regarding consultation when it comes to mental health issues. So making the stakeholders aware of the signs and symptoms and the red flags regarding the mental health issues in adolescent makes a lot of difference. I'm sure the learned speaker, Dr. Geeta Patil, madam, will highlight all the facts, and looking forward to a great learning from her. Thank you so much for giving me an opportunity to have a few words. Thank you, Dr. Sangeeta ji. You are doing a fantastic work. Keep on doing that thing, and I would like to get associated with you always. Thank you so much.
So now I would like to request Dr. Sukanta sir to please give his blessings.
Good evening. It's a pleasure to be here. And I must say that the science is the material that attracts all of us. And this is in the initial part, as you have made the opportunity to speak also, that's another value addition to it. And I'm really grateful that I'm here, and I also want to listen the entire session. So thank you very much. And all the stalwarts, friends and everyone, my special respects to Dr. Pokhraj Bapna ji, who has taught these things, adolescent health by different shairis and others. I still remember when he came different parts of the programs in the country. So thank you all, and wish the program best success.
I'm honored to welcome Dr. Pokhraj Bapna sir, Padma Shri Dr. Pokhraj Bapna sir, to grace us with some few words.
Good evening, all of you. Am I audible?
Yes, sir, you're audible.
Yes, sir.
Our leader, Sangeeta ji Joshi, and Central Leader Himabindu ji, Yogesh Bhai, Dada from Bengal, and Shushma ji, Geeta ji, Yogesh Bhai, and all our own people, Dr. Verma, Dr. Kavindra Sarbhai, Dr. Umesh Khurana, Dr. Patil, and all those who are present here. In fact, this topic is need-based and problem-oriented. And I must congratulate Dr. Sangeeta and her team to choose such topics. This will be a great learning, and we are the winners of the best branch of AHA last year under the leadership of Dr. Geeta Patil. So I'm sure in the coming few more weeks and days and months, we'll be learning more and more. I must congratulate the leader, Dr. Sangeeta, and her team for choosing such a nice topic. And I can see the gathering here. Those who really want to learn from Dr. Geeta Patil. And she is a great teacher, I know. I congratulate and thank you so much for asking me to say something.
Thank you so much, sir. Let's welcome Dr. Sarabhai sir to share a few words with us.
Madam, good evening, everyone. As it has been told by Dr. Pokhraj Bapna sir, that it is a need-based topic right now and is considered as one of the most important. It has got its own value, and at this juncture, if we discuss such topics, then probably we are in a condition to help the society in a larger manner. So let us continue with this particular topic and similar topics in the future as well. Thank you.
Thank you, sir. A very special welcome to today's chief guest, Dr. Amar Singh Thakur, sir, past president of CGAHA. Sir retired as civil surgeon and recently was honored with a fellowship at the IAB conference. Sir has expertise in adolescent healthcare, which will add immense value to our discussion. I would like to invite Dr. Amar Singh Thakur sir to say a few words.
Good evening, esteemed dignitaries and dear friends. At the outset, I would like to welcome Dr. Mrs. Geeta Patil Madam, who has been chairperson of the Central AHA 2024, and she is most humble, and she is the speaker for today's webinar, and we are going to have all the important topics for the mental health of the adolescents. And not taking much of time, I would also welcome today's guest of honor, Dr. Anoop Verma ji, who has been a scientific coordinator, CGAP, and not only he is a very passionate academician and teacher, and who spreads the knowledge and skill to every nook and corner of India, and his passion for teaching and teamwork is unparalleled and well known by everyone. I also welcome Dr. Chairperson Dr. Madam Sharja Phuljhale Madam, who is the professor and head pediatrics, and I welcome and my respect to Dr. Pukhraj Bafna sir, Dr. Yogesh ji, and Dr. Sushma Desai Madam, who took their valuable time and who could present in this CGAHA first webinar. And, and I also welcome all the esteemed delegates and dear friends. I deeply appreciate the opportunity that is given to me to engage in a conversation that is not just timely, but also very important for adolescent health and well-being. I am thankful to Dr. Sangeeta Joshi Madam, our dynamic president of CGAHA 2025, and equally dynamic secretary, Dr. Nitika and Akansha, for giving me this opportunity. Dear friends, as we all know that 1 in 7, 10 to 19 years old experience a mental disorder that accounts for about 15% of the global health burden of disease in this age group. So depression, anxiety, behavioral disorders, they are all among the leading causes of illness and disability among the adolescents. As you all know that suicide is the third leading cause of death among those aged between 15 to 29 years old. And consequence of failing to address these adolescent mental health condition is going to extend to, which is going to extend to adulthood, and that is going to impair both physical and mental health and limit the opportunities to lead the fulfilling life as an adult. So we have a great speaker, Dr. Geeta Madam. Who will enlighten us and who is going to demystify adolescent mental health on its all aspects. So thank you very much for giving me this opportunity once again and not taking much your time. I request Dr. Akansha to proceed with
Thank you,
further.
sir.
Thank you.
Now I would like to request a guest of honor, Dr. Anoop Verma sir, Scientific Coordinator of CGAP. Sir is known for his contribution to pediatric neurology and is a renowned pediatrician. I request sir to say a few words.
Thank you, Dr. Am I audible?
Yes, yes.
Yes. Okay. Respected dignitaries, and I feel that this is a historical event for Chhattisgarh, that national leadership is on platform, on board. Dr. Yogesh Parekh as a national secretary is gracing the occasion. Dr. Atnu Bhadra as a national treasurer is gracing the occasion. Dr. Sarabhai as an executive board member, Dr. Amar Singh Thakur as a chief guest, Dr. Hema Bindu from Hyderabad as a past national chairman of AHA, did so many great work. Dr. Geeta Patil, present AHA national president, Dr. Shushma ma'am, Dr. Pardal, who is the state president of Chhattisgarh at present, Dr. Sawant, past AHA president, Dr. Obesh Khurana, Dr. Ashok Mehta, Dr. Devras, Dr. Rashmi Dwivedi madam is also here from Bhopal, Dr. Sharja Pulvedi as a chairperson of this session, Dr. Pukhraj Bafna sir, Dr. Sukanta Chatterjee, our dear friend from Kolkata, Dr. Kiran Makhija, Dr. Ashwini Agrawal, Dr. Madhu Singhal, and so many from the national platform and from Chhattisgarh as well. It is indeed an honor here today as a guest of honor for this important webinar organized by Chhattisgarh Academy of Health, Adolescent Health Academy. I extend my sincere appreciation to Dr. Sangeeta Joshi, very dynamic, very pertinent, very focused president of CGAHA, and Dr. Nikita Jain, equally competent and very active secretary of CGAHA, for bringing focus to a topic as crucial as adolescent mental health. I may just remind you that Chhattisgarh took the lead, very early lead in adolescent health. We have organized Adolecon in 2004. And I remember that the presence of M.K.C. Nair, the presence of Swati Bhave, Dr. Atul Kanikar, Jason, Sukanta Chatterjee with his wife was the spectator, was the eye opening at that time when initial stage of adolescent health where, in fact, the academy was not formed. So, ladies and gentlemen, adolescence is a transformative period filled with challenges, self-discovery, and emotional turbulence. Mental health concerning among the adolescent have surged in recent times, making it imperative for us, healthcare professionals, educators, and parents to understand, to address, and destigmatize this issue. Today's discussion will shed light on demystifying adolescent mental health, breaking barriers of stigmata, and fostering a supportive environment for our young generation. I am confident that Dr. Geeta Patil, with her vast experience and expertise, and so many lectures we have heard her, will provide valuable insight into adolescent mental health, equipping us with practical knowledge to enhance our approach. I congratulate Chhattisgarh Health Academy for organizing this enlightening session and wish this webinar a great success. Let us all work together to create a mentally resilient and empowered generation. Over to Dr. Sangeeta. Thank you so much for the honor.
So now I think it's time to listen to our speaker, Dr. Geeta Patil ma'am. And I request Dr. Sharja ma'am to please introduce our speaker. Dr. Sharja ma'am.
हेलो
Yes,
मेरी
ma'am.
आवाज आ रही है संगीता?
जी आ रही है, please.
Good evening everyone, seniors and dear colleagues. Respected Dr. Bafna sir, Dr. Thakur sir, Dr. Anoop sir, Dr. Sarabhai sir, and Dr. Yogesh Parikh sir, Central IAP member, and Anoop sir, guest of honor and scientific coordinator of CGIAP, Dr. Sangeeta Joshi, CGAHA chairperson, Dr. Nitika, secretary CGAP, Dr. Nilay, secretary Chhattisgarh IAP, and Dr. Pardal sir, CGIAP president, and all the seniors present here, and all stalwart seniors are present here, Dr. Hima Bindu, Dr. Sushma Desai madam, Dr. Geeta Patil, and all other seniors present here for the webinar. I am thankful to organizers for giving me an opportunity to chair the session. I wanted to introduce today's speaker, Dr. Geeta Patil madam, Chairperson Central AHA 2024. She is Senior Consultant Pediatrician, Adolescent Health Specialist and Counselor, Chaitanya Hospital, RT Nagar, Bangalore. Visiting Consultant, Manipal Hospital, Hebbal, Bangalore. IAP Bangalore President 2017. Karnataka IAP Vice President 2021, Joint Organizing Secretary National Pedicon Bangalore 2017, Chief Organizing Chairperson National Adolescent Bangalore 2019, Organizing Secretary South Zone Pedicon 2020, FIAP Awardee 2021, Editor of IAP Textbook of Adolescent Medicine, National Scientific Coordinator for IAP की बात community के साथ in 2024 and 25, faculty in local national conferences, and 24 publications and so on. So many achievement of Madam. I would like to invite Dr. Geeta Patil Madam for a talk on adolescent mental health, Demystified. Geeta Patil Madam.
Thank you, Dr. Sharja Madam, for your kind words. I know that I'm just sharing my slides. Am I audible?
Yes, yes.
Are you able to see my slides? I will start the slideshow.
Yes, ma'am.
Okay,
Yeah.
hope. So I think, please, I know that Dr. Pukhraj Bapna sir, Himabindu madam, Sushma Desai, Kiran Makija, Umesh Khurana, Ashok Mehta, there are so many learned people there in the participant list. If I go wrong somewhere, please excuse me and you can correct me. I know that this is a very important topic as everybody has expressed. We know that there are 400 million children and adolescents in our country, and the incidence of mental health disorder is 10 to 20%. In different studies, different things, different screening tools, but the number is not correct number, but it is a quite good number that we have to concentrate. And there is a paradox. Have we got trained professionals, especially pediatricians? Maybe many of us, we have got a knowledge, but have we got a skills? And apart from knowledge and skill, have we got attitude and confidence? So many times, though we are aware that body-mind connection is there, we are not being too much comfortable to manage these cases. Because mental health, the moment mental health means they feel, oh, it is quite a lot of things to read and it is beyond our reach, let us refer. But as the mental health professionals are less, it is our responsibility to look after these things. Now, this is a topic given, adolescent mental health demystified. Let me add simplified. I'm not going to go into didactic talks so that people may not keep up their interest till the end. And as the organizing team has told me to discuss some cases about anxiety and depression, not in detail. So let us, in this 35-40 minutes next, what I am going to discuss is what is the importance of mental health. What is the incidence of mental health disorder? What is the psychopathology? What are the risk protective factors? What are the red flag signs? What are the concerns of mental health? Common mental health problem, mental status examination, common mental health screening tools in a simplified way, current barriers in the delivery of mental health services, and anxiety and depression cases. Some of the things are already been mentioned here. So I am going to take you in a little interactive session. Continuous talking makes this topic not very interesting. So let me keep up little interactive. You can answer in the chat box. I know that this is a great challenge for me to compress all the data in 35 to 40 minutes, but I will try my level best. At least I create the sensitization. We know that our country, under 5 mortality, infectious diseases, or maybe nutrition, few things are definitely been very well tackled, but about the mental health matters, not that much. So these are the awareness things to be created is very important. So let us start with the first question. We know that, I think I want all of you to answer in the chat box so that I know the answers, and not for a long time. See, we know that we have to achieve the holistic well-being, physical, social, mental, spiritual, sexual, psychosocial. So now what is mean by mental well-being? Very simple question. So always feeling good and happy enables people to cope the stresses of life, realize their abilities, learn well, work well, contribute to the community. Just means absence of disease, none of the above. What is the answer in the chat box? You can put it fast. I think the answers have started coming. I know that all of you know about that. I'm not going to wait for a long time. Most of you are told correctly. It is the enables people to cope the stresses of life and realize their ability, learn well, work well, contribute to their community. So this is a WHO definition of mental well-being. So to achieve the holistic well-being, mental well-being is very important. You cannot achieve a good physical health unless you achieve the good mental health. And mental health is not static. It is a dynamic thing. It is a mental health continuum. Already I think Yogesh sir has told that it is a mental health continuum. So before that, I think let us see this mental disorder. I don't want to complicate this definition, but in a simple language, I can tell it is a disturbance in individual's cognition, emotional regulation, and behavior. Why this happens? Because of the psychological, biological dysfunction and always and developmental process dysfunction, and this happens mental health disorder. So we understood about mental well-being. Now, these mental health disorders are common in all the age groups. Genetics is very important, but why it is more common in adolescent age group? All of us are expert to tell the prefrontal cortex, which controls the executive functions, rational brain is last to mature. Brain is under construction, amygdala, limbic system, reward center, all are mature. And this is connected to exaggerated response to stress. Cortisol secretion is more than the peer pressure because this is a psychosocial developmental stage. They like to be near the peer and their peer pressure makes them. And previously the personalities were molded by the teachers, community, parents, but I think social media is playing a role now. So that is also reason. I think I don't want to go into details of that, but you would have understood changing lifestyle because joint families are almost extinguished. Single nuclear families, competition, stress to the adolescent as well as to the parents. So all these things we are aware that adolescents are more prone for mental health disorders. But are we having adolescent friendly health services that many? No. We ourselves, every pediatrician should be now adolescent ambassador. So this is the learning thing for us. So all these things, why adolescents are prone for mental health disorders, we understood. Now let us see what is a mental health continuum. See, mental health is not static. It moves from healthy point to disorder point, problem point. So having mental wellness and mental illness at two extreme ends, this is very important for us because this, if you understand, every pediatrician will be motivated, encouraged to learn about the mental health. So the again in the chat box, mental health continuum is a range. Is it right, wrong? I think answers yes. Yes, most of us, we are clear that mental health continuum is a range. So let us see about this is the, you can see this scale. If we know about that, we know that where we stand. See, first is a healthy point. What is the healthy point? Where we can cope up with the turbulences, stability is there, relationships are there, normal sleep, eating pattern, we are doing for the community, taking care of self. But there are some reasons which I already quoted may cause a psychological distress here. So that may lead to mentally unwell. So from the healthy point, problem point, psychological distress, then disease, where poor concentration, not able to cope up with the stress, change in appetite, sleep pattern, hopelessness, helplessness, substance abuse, self-harm, withdrawal, lack of judgment. These are all mental health concerns or red flag signs. So what happens? You may be at the psychological distress point, but depending on your inner skills, resilience, you may go to the mentally well. or you may become mentally unwell. So not only your internal personality life skill, but external also. The environment we pediatricians are there, which we can catch at the correct time. This psychological distress and prevent them to go to the mentally unwell stage. So this is a very important to understand. Mental health continuum is there, and we are their environment and the circumstances also. We can point up the continuum and shift position. You may improve, you may deteriorate. So we can play a major role. 50% adolescent mental health disorders are preventable. This is the thing which I want to emphasize. So getting stressed, is it a mental health disorder? Again, answer. I think the answers have started coming. Without wasting time, everybody knows that no. Stress is definitely very important thing. The experience of stress may be there everywhere. You may have death of someone, there may be some disaster. Stressful life, many excessive stress may contribute to the development of mental disorder. But this cannot be called as a mental health disorder. Otherwise, we all are stressed in our life. There are many stressful things, but we have got to use stress. But we have to see that it doesn't become distress and lead to mental health disorder. So why we are focusing on mental health during adolescence? Always any medical thing we say early diagnosis, early intervention, management is better. So early detection and management definitely leads to better physical mental health of adolescent, and it gives a triple dividend to the country. Definitely it saves the cost, and high prevalence of mental health already we discussed. And following COVID-19, it has become urgency because we know that there were so many sessions we attended. There are a lot of psychosocial changes have happened. And which organization started first program is RKSK. So some of the slides, my slides are from RKSK. So I think every study has mentioned little different numbers. So globally, 1 out of 7 adolescents may experience mental health condition. This data of RKSK is pre-COVID. So let us move on to the not to the number. Like mental health account for 16% global burden, we say 13%, but mental morbidity among adolescents is 7.3%. Mental health concerns are found in rural, non-metro, metro. See, it shows that metro is high, shows that it is because of the lifestyle. So we have to focus on mental health. So prevalence, see, 13% of the global burden, 7.3% prevalence. See, roughly we can say 10 to 20% is a mental health disorder in children and adolescents. If you add substance abuse, it increases. The distribution among boys and girls is equal. So WHO has done a study prevalence of depression and anxiety in Indian school. And this study shows there is a 25% and 8% depression and anxiety, 11% use of drugs, 7% were bullied. But this is also 2017 study. So common mental health disorders during adolescence we should know. I'm not going to cover everything because eating disorders on its own is a topic, risk-taking behaviors, childhood mental disorders. I'm going to concentrate on emotional disorder, anxiety, depression, suicide, case-based discussion. Before that, let us see not to forget serious mental disorders like schizophrenia and bipolar disorder. Schizophrenia is psychosis, hallucination, delusions, disbelieves, and bipolar, one moment you are very delighted, other moment you are sad. These things have to be referred immediately. That has to be remembered. So now why I am talking about this internalizing disorders and externalizing disorders. See, internalizing disorders are the disorder which cause problem to themselves, but externalizing disorders are problem to the environment also. So now let us see this, our question. These are the internalizing disorders except. Please share your answer so that why we are talking about internalizing and externalizing. Because the management is also different. We know that once we know the internalizing and externalizing disorder, we know how to manage. So already the answers are there. Conduct disorder, opposition defiant disorder. Opposition defiant disorder is a little later age group. Conduct disorder is earlier age group. Depression, anxiety, phobia, eating disorder is internalizing disorders. So I told that why we are discussing this topic is because of the management. So common mental health problem already we are discussed. We are seen in that figure. Just I am enumerating in this slide. Maybe everything which we may not be able to do or learn. But let us remember 50% manifest by the age of 14 years. These are the internalizing disorders like depression, anxiety, psychosomatic disorder, eating disorder, externalizing disorder like conduct disorder, opposition defiant disorder, ADHD, juvenile delinquency, substance abuse, schizophrenia, impulse control disorder. Let us now, we have got a basic idea about mental well-being, mental health continuum, why we have to concentrate in adolescent health problem, what are the common mental health problems. So now psychopathology, this is a very little, there are Erik Erikson's theories there. We'll not go into details of those theories, developmental theories, but see, let us compare. When there is an infectious disease, we tell host, environment, and the pathogen. Same way here, individual is the host, socio-economic influences. I think I saw somewhere that environment is very important. I do agree. Socio-economic chat box, it was there. Socio-economic influences, that is the environment. Stressors in the life of an adolescent, that is a pathogen. And their interactions are very complex. So we have to remember psychopathology has to be understood. It is a theoretical aspect, but we have to understand these things. So these are the adolescent mental health concerns, or we can call as a red flags, like sleeping problem, loss of appetite, dizziness, generalized aches and pains, declining academic performance, sadness, anxiety, mood swing, loss of motivation. But let us not label as a mental health concern till we rule out the organic causes. And this age group, we know that anemia and hypothyroidism should not be forgotten. So first screen it and do office practice, screening tools, and then only label as a mental health problems. So first, let me highlight what are the protective factors. First, and this is also RKSK slide is there. Age appropriate physical and intellectual development, high self-esteem, good social skill, positive role models in the form of parents, teacher, good emotional support, from good academic success, healthy peer engagement, connectedness to the community, and having a good hobbies, extracurricular activity definitely help to protect. But there are certain risk factors, biological, psychological, family, school, and community. Let us know about that, because this is very important topic. Unless you know the risk factor on the individual level, female gender, they say it is more common. Research shows that genetic predisposition, perinatal insult, because these things are very important when you take the history. Hospitalization, head injury, conduct problem, behavioral issues, developmental disorder, chronic diseases, low self-esteem, poor social and communication skill, early substance abuse. And the family factors, dysfunctional family. There may be a inconsistent discipline style, negative family environment, single parent, divorcees, marital conflict, parent with a mental health problem, drug abuse, parental unemployment, lack of adult supervision, poor attachment with parent. We have seen during the COVID, family structure was distorted. School, definitely school is a thing where we need to have a important thing, that there is a academic pressure, change in school, poor school performance, then many traumatic events, school violence, peer rejection, peer pressure, bullying, poor student-teacher relationship. Some of them are bias, breakdown or lack of positive friendship. And then relationship problems also, which we have to remember. Then community level, you know, the relationship, romantic relationship also, it is missing here, but that is also very important in this individual factor. Community factor, socio-economic problem, homelessness, discrimination, gender discrimination, natural disaster, war survivors. You know that post-traumatic stress disorder, lack of access to the support system. So already there are some current barriers in the delivery of the mental health services are talked, because There is a lack of adequate and appropriate information, myths, stigmas, misinformation, cultural beliefs differ because our country is so wide, everywhere there are different concepts. Stigma associated with that person having mental health disorder is considered as a mental illness. They don't like to go to mental health specialists, psychiatrists. And there is no prioritization in our policy frame, but of late it is changing. And all of us, we know that mild to moderate mental health issues and disorders are underreported. And I already told number of mental health care professionals. I'm not telling only psychiatrists, pediatric psychiatrists, but they are less in number compared to the burden of the mental illness. So we need to sensitize. I already told each pediatrician should vouch to become an adolescent ambassador. The consequences of failing to address these adolescent mental health problems impairs the physical and mental health. But let us not forget, there's a neurodiverse adolescents are also there in everywhere globally, and their needs are different and higher chances of having mental health problem and emotional problem. I'm not going into detail. This is the basic my discussion. I have finished in this 20 minutes time. Let us go to the cases. I told that I'm going to discuss more of a emotional disorder that applies for other mental health disorders also. So let us start with this case. I think this is a commonly encountered in metros. A 15 years old girl, both the parents doctor, not having time for her, studying in a good school, and but school started because her performance started falling. So school directed that she should be evaluated by a professional. She was interested in school drama. She had a good friend whose phone call she had stopped picking up. There is younger brother whose Bina she was attached to that. So I think there was a background sound was there, so I closed the door. The younger brother, she was not spending time, she was spending in the room. Parents were not able to spend time with her because of their profession. They had a lot of expectations, and we took a thorough medical history, birth history. Other cases, I'm not going to discuss the history, but we are very expert in taking the history, birth history, hypoglycemia, seizure, sepsis. We already saw developmental history, immunization, family history of mental health disorder, COVID, chronic health disorder, past history, nothing contributory, no chronic disorder. Our growth chart was almost, BMI was 20, vitals were normal, but she was little pale, no thyroid enlargement, to have any body image issue, did not have acne or spinal deformity. And we never forgot because of the poor performance, hearing and vision was normal, sexual maturity rate was normal. But as I told, hemoglobin was 10.4 and thyroid functions were normal. HEDS was done thoroughly. There was a parental discord that parenting, because unpredictable parenting expectation and poor concentration in the class, falling school grades, reduced appetite, unhealthy eating habit, body image issues, not interested in previous activities. Very important things is she has put on 10 kg in 1 year. No substance abuse. I think she has a body image issue. I think I have mentioned here. Sexuality, menstrual cycles were menstrual cycles were regular, no boyfriend, depression, suicidality, depressive thoughts, but no suicidal ideation. Spirituality, I think that is gone down. She was a God-fearing person, as the family also was there. Then safety, no rash driving, no excessive use of media. And she was not media addict also. So very important thing I want to highlight, apart from heads, we should know this is an unstructured tool, mental stress assessment. Good eye contact she had, she was a sad look, well-oriented, withdrawn. She was not happy when her mother asked to talk to a doctor. She shared that she was anxious because she was overweight, her grades were falling, losing friends, drama group people were treating her badly, maybe somebody was bullying. She was feeling that she is useless to all in her life. She was very articulate and she opened up. She had never attempted self-harm and would never do it. That was her strength. Then PHQ2, PHQ9, TSQM, this I'm going to, screening tool I'm going to discuss little later. So we diagnosed that there is a poor school performance with depression, maybe moderate, normal intelligence with mild anemia. So we understood that mental status examination is also equally important. It should start when the patient enters in your center. In the waiting area, our receptionist should monitor interaction with the surrounding as well as with the attendant. Mental state examination gives a lot of clue to us in the appearance, mood, speech, thought, perception, cognition, abstract reasoning. These are a little difficult. We need to read about that. So this case was managed with the parental counseling, correcting lifestyle, nutrition, exercise, medication were required because I think we can also start the medication because some people may ask the question that legally are we allowed? I think we can. Fluoxetine because recently it was told 10 to 20 milligram, but it is for a long time because recurrences are very common. Started on iron and folic acid, reinstated hobbies, promoting friendship, and resultant excellent results in the final. So we understood this case we could manage in our clinic. But this was the boy, 15 years, average student, 9th standard, brought by the parents that he has failed in 4 subjects and school he is not going. Not sleeping well, eating well from last 3 months. Not talking to old friends, same thing. He was not liking the activities which he was liking before. He had a headache, feeling tired, irritable. Please remember, there was a triggering factor. Lost both the grandparents, uncle, auntie, whom he was close during COVID. Feeling useless and sometimes felt like ending life. Parents were very worried. Why I am telling you, if you have done counseling, this is the thing where our antennas should be up. Because here we have to be very careful because he has expressed suicidal ideation. Though his Beck's depression, BID score was 20, immediately refer to the psychiatrist and counseling done. But we have to do hand holding because many times parents feel he's just scaring them. It is not. We have to be very cautious. The 2 cases where there is no suicidal ideation, we could manage. And maybe we know that we were able to manage because the family was involved. Here, he has expressed the suicidal ideation. So we have to be very cautious. Once I have come across a patient, mother showed a picture drawn by one girl that there is one stick hanging to the fan. Means she was planning for the suicide. We have to take the indirect clues. And this child also improved, school attendant, passed in a month. So let us see what are the indications for referral. We should not sit on the case. Every case where it is required, it has to be referred. Can you share the answer? I'm very sure all of you know that where there is a reference to be done. I think all learned audience, they know that when to refer. This is very important thing to be remembered when you are treating the mental health problems. Like a privacy and confidentiality is very important, but there are certain things which we have to remember that it has to be broken. So red flags and need for reference, suicidal tendency, even suspicion, development of psychotic symptoms, major mental health problem, lack of parental supervision, problems at multiple areas, school, social, family, comorbid conditions, abuse, please refer. So we understood about the depression. So depression in adolescent is increasing worldwide. I think some theoretical aspect. In past several years, already I have mentioned, so there is a 40% chances of relapse in 2 years, 70% in 5 years. So follow-up is very important. It leads to poor psychosocial outcome, academic performance. Reported prevalence is 4 to 8%. Almost half of the adolescents with depression are diagnosed before the adult, 14 years of age. Incidence is 5% in young adolescents, but 25% in late adolescent. 1/3 of the adolescent attending psychiatric clinic are suffering from depression. Equal incidence in girls and boys till puberty, 2 to 3 times. Then it becomes 2 to 3 times more in girls. So this is a topic of discussion, but let us not go into detail. They say that it is more common in lower socioeconomic status. I myself personally don't agree with that. It is common everywhere now, mental health problems. Family history, genetic predisposition is very important, and we have to remember that biological and chemical changes in brain are there. That is the reason biopsychosocial model indicates that there is a necessity of drug therapy apart from CBT counseling. So some endocrinological factors also, chronic diseases, some of the collagen vascular diseases, because there are some, I think some drugs, I think we know that some of the drugs uh, we have to be very careful because they themselves have a suicidal tendency. Fluoxetine also is having that. Depression always presents with a comorbidities. Depression doesn't mean only that. It may be associated with a conduct disorder, panic disorder, anxiety disorder. So very important thing I want to highlight here adolescent, because of their developmental stage, they are very moody. Their behavior is, whether it is a normal or abnormal, very difficult. There are psychosomatic symptoms, so very difficult to diagnose depression in adolescent age group, as mood alterations, unpredictable behavior is very common in this age group because of the hormonal changes. But there are differences between adult and adolescent depression, because here there is a social and interpersonal difficulties lead to low self-esteem problems. So depression is very important because life-threatening 35% of the depressed adolescent attempt suicide. And let us move on to the suicide. Very important. Second case, when he expressed suicide, immediately referred to the psychiatrist. So India has the highest number of adolescent suicides in Southeast Asia. Highest number of suicide occur in the age of 15 to 29. Suicide attempts are more than the reported suicide. For every suicide, there are 20 suicide attempts and 10% successful. Suicide is a third leading cause of adolescent mortality in India and fifth leading cause globally. Every hour, one child dies of suicide. Every day, 35 students commit suicide. One third among all suicides in our country are adolescent. So we should be aware of what are the symptoms and signs of suicidal ideations. Because when you see a depressed child, this is very important to do the screening. They just may have a psychosomatic symptoms. Their withdrawal behavior, feeling hopeless, helpless, depressed, eating, sleeping problem, change in mood, poor academic performance, isolating friends and family. But very remember, start to make arrangement for the time when they are gone. I told you one description of the picture what mother gave me, that fan and stick hanging by the rope. That was the suicidal ideation, reckless behavior. All these things we should be aware. There are some non-suicidal self-injury. Many times we doctors also take it very lightly. It is a deliberately they inflict the damage, pain or both to one's bodily issue without suicidal intent. But it may be cry for help, and it may be to relieve the stress, anxiety. There may not be intention of ending their life, but this is a suicidal risk factor also. So superficial cuts, injury, this is a feature of personality disorder, very difficult to make out. So this is a very famous warning signs of suicide is pathworm. It is available everywhere. I am not going to go into detail. Emergency mental health referral is needed the moment you remember this is pathworm. Ideation, substance abuse, feeling purposeless, having a severe anxiety, feeling trapped, hopeless, withdrawal, anger, reckless, mood changes. So these things where we have to properly do. There is a screening tool. Just I'm telling, this is not a very difficult screening tool. Ask you for suicide screening. So there are about 5 questions. First 4 questions, it is in past few weeks what you felt. You felt like feeling dead, family, feeling, maybe you feel that family would have been better without you, or thought of killing yourself, or try to kill yourself. If there is no answer, don't go. If there is one answer also is yes, go to the last question, which is very important for emergency management, that are you having thoughts of killing yourself right now? There are many things are there, because once I was called to a junior college because one of the girl committed suicide, and copycat suicides are there. So they called us to counsel the other children, and I told the teacher to do this screening, and it helped. There were 6 girls were feeling like committing suicide. So we could manage. So this is a very important part of the screening tool. Obviously, DSM-5 is the gold standard. Depressed mood, loss of interest. These are all things mentioned. Loss of weight or increased weight, loss of appetite, sleep disturbance, psychometer changes, tiredness, fatigue, low energy, decreased efficiency, sense of worthless, impact. See, these are all things are managed. It is mentioned in all Google, Chat GPT or books. Must be more than 5 criteria for at least 2 weeks. They say A1 or A2, but at least more than 5 for 2 weeks. There is a PHQ2. It is just 2 questions. It is for all the age group. It is a first step approach. This is not a screening tool, neither to assess the severity nor to monitor. The moment you feel there is a little interest or pleasure in doing things or feeling down, depressed or hopeless, move on to PHQ 9. There are 9 questions of those what we have seen in the DSM-5, and there are modified for the adolescent age group, where it helps to identify depression. It is very sensitive and specific, and it is very important to identify suicidal ideation. The scoring is there, 0 to 4, 5 to 9, 10 to 14, 15, 19. This we have to learn, and you can keep this printed copies on your table. So how to manage depending on the severity is mentioned in this table. All these things are available in our IAP-AHA textbook of adolescent medicine, which was published last year, and most of the things are clarified there. So this is a very important tool where I think all of you know Beck's depression inventory score is there. There are 21 items are there, and there are responses. According to those responses, we have to score the make the score. So this is very important. This will judge the severity, monitoring. All these things are very important. This is a very important tool. But I think everyone in the primary setup also should have a teen screen questionnaire mental health, TSQM. This is by our MKC sir. And it is a very powerful screening tool in primary care. Very simple questions. It helps to screen not only depression, but anxiety, ADHD, OCD, conduct disorders, substance use disorder, and it doesn't take much time. The diagnostic accuracy, I think the people who are interested, please read this. This is a very important. This is also given by Dr. MKC sir. This always he mentions, with his permission, I have put it here, Miss World with Depression Crying. So all those 9 points are also mentioned here. So we are going to see next quiz now. Which is the wrong statement? I told you about the screening tool. PHQ2, primary one. PHQ9, after PHQ2. Then Beck's depression inventory, definitely important. DSM-5 is a gold standard. So let us see how much we are grasped. I'm not telling that we should be able to tell everything, but which is the wrong statement about depression screening tool? Is it Beck's depression inventory is a self-report questionnaire to judge the severity of depressive symptoms? PHQ2 is a confirmatory screening tool. PHQ9 for teens can be used between the age of 12 to 18 years, and it doesn't take much time. Important is TSQM, very important to screen. So which is a wrong statement in this? Can you answer in the chat box? So at least I will be satisfied that some screening tools which I have told that everyone has understood the importance. This is a very important thing everyone has to know. So PHQ2, don't end at DSM criteria. PHQ2 is just a first step, because many times I have seen when we were taking somewhere classes, they were just stopping at PHQ2, maximum PHQ9, not at all. So this is just a first step. This is not a confirmatory screening tool. So when you go in the field, you can use this and then move on to the other things. But apart from that also, we have to do the work. So dealing with psychopathology is very important. I have already told everything. I'm not going to repeat. And office friendly tools are very important. I think all of us, we are doing now PCR molecular study, respiratory panel, neurological panel. Why not to learn this also? I don't think this is that difficult, and that PCR, and not costly also. and we can help many people. So learn these tools, and timely teaming up is very important. So already we know that management, definitely counseling, psychotherapy, CBT, REBT, drugs, family therapy, very important, and management of comorbidity. So we have seen the depression. Next 5 minutes, I am going to tell about the other two cases without elaborating anything. She is a 13 years old girl from middle class family, always complaining of headache, giddiness, not able to sleep or eat well. Parents, grandparents usually very concerned. She missed many school last 6 months. All the history was normal and the poor school performance of recent onset. She was investigated for chronic diseases. Nothing was contributory. Why it is? She was put in the integrated approach school, which is very common in the metros. They start from morning 8 o'clock, come back home at 6:37. Everything is done there. Tuitions, and every time some competitive exams are there. Every 15 days she had a test. So she developed anxiety. This is the second case. This is the one case of anxiety. This is a Mohan, 15 years, was brought by the parents. This is my case only. This is after that Kerala, there was one flood. He was brought for not doing well in studies and worried about traveling, feeling always sad, always watching news, reading newspapers. He read somewhere the world is going to end in next 2 years. He started feeling that doom has come. He's lost his uncle from Kerala that in the floods. So this was a climate anxiety. So these are the anxiety cases. So now let us see. See, we will be fearful sometimes. We are stressed sometimes. So is it anxiety and fear are one and the same? Is it every fear or worry we should call as an anxiety? Let us see in our question, which is a right statement about the anxiety and fear. Fear is an automatic response to specific threat in the present, while anxiety is an anticipatory feeling of dread about future threat. Both can cause physical symptom, but they can be treated differently. Fear and anxiety are the same, should be treated in the same way. Fear and anxiety often occur together, so these terms are interchangeable. There are not many ways to cope up with anxiety, like relaxation technique, exercise, talking to someone. So already there is an answer. I think all are promptly answering. So fear is an automatic response to the specific threat in the present. So anxiety is a anticipatory feeling. It may not be truth also to the future threat. So this is very important to differentiate between fear and anxiety. So what is anxiety? See, it is not that you are very stressed, you are very anxious, but you are not disturbed that much. But when you call anxiety disorder, it is disproportionately intense, chronic, potentially irreversible reaction to the imagined threat, and it operates through brain, body, emotion, cognitive changes, and their interaction with the environment. Most common manifestation of anxiety disorder, I'm very sure all of you may be knowing, school refusal. Most children perceive somatic symptoms. We have seen many of them don't like to go to school, and the reasons may be different. So to call it as a pathological anxiety, there are DSM-5 criteria are there. The person become disabled, interfere with social interaction, development, interferes with achievement of goals, quality of life. It can lead to low self-esteem, social withdrawal, academic underachievement. Average onset is 11 years. Commonest psychiatric problem, maybe depression and anxiety. Both may be equal incidence depending on the reporting. And definitely anxiety will be associated with weight loss, pallor, tachycardia, tremor, muscle cramp, paresthesia, hyperhidrosis, flushing, hypereplegia, abdominal tenderness. So there are different types of anxiety disorders, and causes are family history, genetic. They say maternal over-involvement also. They are temperamentally, environmental also. So let us see generalized anxiety disorder. These are all DSM criteria. It is not for any specific anxiety, non-specific, they are persistently worried. There may be phobia, panic disorder associated with headache, restlessness. Phobia is fear and anxiety triggered by some specific stimulus. School phobias are very common. It may be part of separation anxiety, social anxiety. Panic disorder, brief attacks of intense terror, apprehension, shaking, confusion, dizziness. You have seen the conversion disorder. The girls brought from the school in the assembly, they would not have taken breakfast, they start hyperventilating, get a syncopal attacks. Suddenly they become like that. And it can be triggered by stress, fear, exercise, and hunger also. Social anxiety is very common in this age group because they feel that their psychosocial development, they are watched by someone, so they feel they are anxious. Separation anxiety till 3 years it is okay, but beyond that it is pathological. So this is a obsessive compulsive disorder. So use DSM criteria everywhere. The risk factors already I told, they are the common risk factors everywhere. And here body image issue is very important factor we have to remember. So there are screening tools, generalized anxiety disorder questionnaire. This is also not very difficult. It is severity. Because of that, we can decide up the management. All of us, we know about the screening tool, SCARE. It is for the child and parents. It is self-reporting. If the child is little smaller, you can tell them and get it written. So depending on the scoring, we can tell that what type of anxiety disorder, because management is different. So we should be able to differentiate between normal and abnormal anxiety. I don't say normal, but maybe pathological and non-pathological. Different age groups have different type of anxiety. Prognosis depends on severity, availability of competent treatment, child resilience. Some of them continue during adulthood, but early. See, we know that anxiety, many of them miss their exam because of that. So management should start well in advance. So this is a question again. Now, I think this you will be able to answer. I'm just moving fast. Generalized anxiety disorder will have all except long-lasting anxiety, 6 months, focused on any object or situation, non-specific persistent fear and worry. It may be associated with headache, restlessness, abdominal pain. I already told it is a focused on, no focus on any object or situation. They are forever worried. Then all are screening tools for anxiety except SCARE, generalized anxiety disorder, TSQM, PHQ-9. Can you answer in the chat box which is not an anxiety screening tool? I think already answered. PHQ-9, we talk about the depression more. So already we should know what are the screening tools. So pediatrician on the responsibility of helping the adolescent and families and need to learn some evidence-based, less time-consuming counseling techniques that are useful in variety of problems. A motivational interviewing, REBT. I think I'm very sure all of you may be knowing about REBT and motivational interviewing. Our personal experience, these are two tools are very helpful. If you know these and some screening tools, you can do mental health and mental status heads. We can do a lot of work in the mental health. So CBT definitely medication. So what are the things? Which are the simpler tools? CBT requires special training. Can anybody answer? So obviously motivational interviewing and REBTs are the simpler tools. So principles of motivational interviewing, you should know: expressing empathy, developing discrepancy, supporting self-efficacy. I'm not going to go into detail. It will be a separate topic on its own. REBT, there are core philosophies that belief systems shape our emotions and behavior. And definitely it works for emotionally disturbed teenagers with a practical problem. So there are many techniques are there. So we role of different stakeholders in identification. Now I come to the end of my presentation. It should be possible in the primary care, school level, government level, community, social media level. So primary care level, we are the people whom we have to be aware and we can guide the parents, teachers. School level, definitely we have got a teach module like module which was done last year. which will help to teach the teachers. Government level, obviously, government will take in RKSK and other new, I think, school health program also has started, community level. So by this, we can make the parents and teachers, they are also one of the important stakeholders, to slightest change early and take it necessary action so that we can prevent the disaster. And it is better to be safe than sorry. So these things have to be tackled on all the levels of identification on primary care, school level, government level, social media. Social media is so powerful. We can do that. Various apps are available. So now let us not blame the government. Government has come with a very important that telemanas. Telemanas reflects the government commitment to nurturing the nation's mental well-being. There are toll-free number is there. My personal experience, it is available 24 hours and really helpful. So immediately, and it is in a different languages. So it is very important. It facilitates communication between callers and mental health professionals. So it is, there are, because I am from Bangalore, in Nimans, we have got a center where suicide prevention helplines are there. So we have got a suicide prevention day, World Suicide Prevention Day. We have got a World Mental Health Day. All these things should be equally with the same zest and enthusiasm should be conducted as breastfeeding complementary feeding days. So my key message is now early identification of adolescents at potential risk of mental health issue is crucial for timely intervention and providing support. Healthcare professional involved in care of children should be aware of risk factors and red flag signs. School teachers, counselors should get training for identified teens, taking appropriate measures. Different stakeholders, as I mentioned, should be made aware of this and we can do it. So thank you very much. I have taken a lot of references from RKSK, our textbook, and some other references. MKC sir has guided me and he has told me to share some slides. I made it very simple. Hope at least I have sensitized that everybody has to learn about the mental health, same as a PCR molecular test for all the panels. Thank you very much.
Thanks a lot. Thanks a lot, Geeta ma'am, for such a wonderful and such a simplified session. You have indeed covered all the aspects beautifully. It was a mind-blowing session and you have truly enlightened us about the mental health. I am sure all of us would be benefited and would be able to diagnose such cases in our day-to-day practice. Thanks a lot, ma'am.
So I think relaxation techniques are very important. Pukraj Bapna sir has taught us so many times. He's also one chapter is there in the book. Please go through that chapter. He has mentioned about all those relaxation techniques for the mental stress. Is it not, sir? You have mentioned everything in that. All the techniques are there. So I think it is almost 10:30. I think all of may be exhausted to listen, sir. Yogesh Parikh, sir, are you there?
Yeah, okay, okay. Okay, 1 minute. Yes, madam, I'm a little bit busy. One meeting is going on.
Okay, sir, no problem, sir.
Yeah. Okay.
Nitika?
Now we would
Please
like to
unmute
hear.
yourself. Continue.
Now we would like to hear expert comments from our distinguished guest. I invite Dr. Madhushi Deshpande ma'am to share her insights.
Thank you, Geeta madam, for your excellent overview of the topic. The topic is as such very difficult as everybody thinks, but you have made it very simplified and rather practical and patient friendly. Thank you very much.
I request Dr. Devraj sir for his valuable comments.
He is not there.
Yeah, I'm here.
Okay.
Thank you, Dr. Sangeeta, for arranging a very nice talk. We have learned a lot about the mental health, and as said, Dr. Geeta has very nicely explained all the things. I must congratulate you for keeping this topic. Thank you, Dr. Sangeeta. I I request Dr. Rakesh Pardal to make it a point that our academy more members should join it, because is already told by Dr. Geeta that yes, our 13% of population is having this mental problem. So it's a burning point, and we all have to be to get sensitized in this subject also. Thank you, madam, for a nice lecture. Thank you.
Thank you, sir. I invite Dr. Rakesh Patil, sir, President CGAP, to share his thoughts.
Hello, am I audible?
Yes, sir.
Yes, sir.
So, I congratulate Geeta madam for her very impressive and simplified talk on anxiety and depression. Very nice. We are enlightened with the subject. And I hope that we in future also we will like to arrange all this type of webinars in our platform. And I am very happy that Dr. Devras has asked you that IAP Raipur, Chhattisgarh should take initiative to arrange all these things. So I promise that IAP Chhattisgarh will in future arrange all such type of CMEs and make more and more members to join to our platform. I am thankful that you have given me opportunity to thank Geeta madam for her very nice talk, and we all are enlightened with that. Thank you very much.
I request Dr. Umesh Khurana, sir, to speak few words.
Many thanks to the dignitaries, especially Dr. Sangeeta Joshi, who have organized this, and Dr. Geeta Patil for a excellent presentation. What I strongly feel is that after theory, there has to be practicals, and therefore these messages which Dr. Geeta has given us, we should take to various schools of Chhattisgarh, and we should sort of train the teachers, because the 30% mental health, I mean, it is not possible. The IAP members should take help of the teachers in screening, in early diagnosis, and also the teachers can contribute a lot in helping them to learn yoga in the school, so that they are emotionally stable, they are picked up early, and they and suicides and all these fatalities are prevented. Thank you very much, thank you, Dr. Hemamindu madam, that under your this leadership, we are having these programs. Thank you, everyone. Thank you, everyone.
Thank you, sir. I just want to respond here a little bit. I really congratulate Chhattisgarh, both AHA and IAP for taking such nice topics. I would like to also say that AHA has always been in the forefront to get the mental health, as a priority. We have been focusing on capacity building our colleagues, our pediatricians, and how to screen for mental health, how to identify the red flag signs, how we can manage. Earlier, there was so much of stigma, and even pediatricians, because we were not trained in a formal training during MBBS and MD. So whenever we feel that there's something not physical, if it is mental, then we usually refer to a psychiatrist or psychologist. But since we don't have enough number of psychologists or psychiatrists, and we all AHNs we are now taking care of holistic health of the adolescent. And we have been empowering our colleagues in IAP through the AHA platform, at least to basically screen what is mental well-being, how to identify, and we can certainly do something like counseling, different types of counseling, what Dr. Geeta has said, and the psychosocial screening, the heads and all. Still, though we have been doing this for quite some years now, there are many pediatricians who still hesitate or not confident about handling mental health issues. I think we all have to break this barrier, and what challenge we feel comfortable dealing with that. We'll start doing it, you'll develop confidence. Like Umesh Kurana sir rightly said, that we should really start going into the schools and colleges, talk about this, and then maybe, by being a principal of a medical college, I really feel sorry. I had a very bright student. He was one of the toppers in the class, and we saw him, he was missing. And then the police had caught him there was a river nearby, and from that side he was actually he had an suicidal attempt, and he was having severe depression. We were not able to identify, he doesn't look depressed on just looking, but on history maybe he was just attempted, and then it was so difficult. So it may not be a typical presentation like sometimes what we are hearing. So we had got him, and then we saved him, but we sent him to this family to just take care of him a little bit, because he was under medication and somebody has to be with him for some time. But very unfortunately, he missed his missing child. He left the home, so we don't know where he is. It really bothers all of us. So it is so much rampant. It can happen to our own children, to our neighbors' children. So we should actually be very empathetic towards this. Please, we need to really, it is an urgency. It's a very much needed topic. Let us all open up. Let us help the adolescents, our youth, and help each other. And rightly said, if little bit thoda knowledge apne ko thoda aa gaya hai, तो let us actually implement it in our schools, colleges, in our communities. थोड़ा वहाँ पे जाके थोड़ा काम करें और identify करें, help the teachers, parents. So that is my request. I really appreciate Dr. Rakesh Pardal sir, who is the state president, who has accepted that they'll work along with AHA in Chhattisgarh, and request more and more IAP members to be part of our AHA, so that we have such focused capacity building discussions. Thank you one and all. Appreciating the team once again. Thank you.
Pukhraj sir, a word from you, please.
हिमा बिंदु तो ज्ञान की सिंधु है, के बाद मैं क्या बोलूं। गीता जी, आपने तो गागर में सागर भर दिया और 40 घंटे के व्याख्यान को 40 मिनट में कर दिया।
बिल्कुल सर,
गजब का व्याख्यान था गीता जी। और आप तो हैं एडोलेसेंस की मीता जी। एडोलेसेंस में मेंटल हेल्थ की कितनी कथाएं हैं, कितनी व्यथाएं हैं, आपने बखूबी बताया है और सावधानी भी जताया है। आपको बधाई, शुक्रिया, आपने बेहतर ज्ञान दिया। बधाई संगीता, निकिता, आपकी क्षमता का सबको है पता। जागते रहो, जगाते रहो और ऐसे ही वेबिनार्स कराते रहो। थैंक यू सो मच।
Thank you, sir. Thank you. Thank you so much.
बड़ा अच्छा लगता है सर, so nice. Thank you.
Invite Arvind Sawant, sir.
Sangeeta, it's a great team you have. You have very good companions with you, Akansha and Nitika. All are doing very well, and a very good team is formed, and good sessions are organized. You are organizing very good sessions. और आपके साथ तो डॉक्टर हिमा है, हिमा बिंदु सर ने बताया उनकी छवि को। मैडम, शी इज अ वेरी हार्ड वर्किंग एंड ग्राउंड लेवल वर्कर. शी इज डूइंग ऑन ऑल लेवल्स, and I know it that under her leadership will definitely do more and more work in adolescent health. And there are definitely the adolescent health needs more importance, because from childhood to adulthood we are children are transforming, they are not knowing, and mental health issues are very common nowadays. Anxiety and depression. We had been last week we had been to the schools and seeing the anxiety level to the students. They need it that we should have make more number of pupils. We should include more number of pupils, and we should go to the schools and all levels, so that we can teach them and then we can de-stress them as much as possible. Dr. Geeta has covered all the features. The important thing that she told that early identification, and as well as we'll have to use all tools which are important, which we have, so that we'll identify and intervene the problem. Thank you very much, Sangeeta, and I am seeing that Dr. Himabindu is from the very beginning. She is here and the last. This shows her interest and her determination and dedication to the.
We are cascading the Well Youth Initiative along with IAP. Please join in large way, because this is the way we want to go to the schools and colleges. Mental health is one of the priority areas in that module, along with sexual wellness and digital wellness. Request all of you to be part of this movement. Thank you.
We are going, madam. We are going to the school and colleges nowadays, and we'll definitely will help them if whatever is possible. Sangeeta, unmute.
Akanksha, are you there? Hello, Akanksha.
Thanks a lot for giving me opportunity. Yogesh sir, are you free now?
Yeah, madam.
Yeah.
So thank you very much, Dr. Sangeeta Joshi, madam, and Dr. Nitika Jain and Dr. Akansha for inviting. And Geeta Patil, madam, is always the great means expert for the AHA. Whatever the topic you can deliver, madam, excellent way. So thank you very much. I have heard most of after that I have busy some phone calls coming from the office and the seniors. So I have to, but madam, it is great pleasure to hear from your delivery of the talks. Thank you very much, madam.
Thank you, Yogesh sir, for being here till last. Akanksha, over to you.
I will join, madam. I will join whenever I get the opportunity. I will be with you.
Thank you, sir. Thank you. Akanksha, over to you.
Thank you, ma'am. Thank you, sir. I thank our distinguished speaker, Dr. Geeta Patil, ma'am, for a valuable insight. Respected leaders of Central IAP, CGAHA, CGIAP, and experts for their presence and guidance, our attendees for their active participation. I thank Dr. Sangeeta Joshi, Chairperson CGAHA 2025, and Dr. Nitika Jain, Honorable Secretary CGAHA 2025, for their leadership in organizing this important discussion. I thank Team Zuventus for organizing this webinar, and special regards to Mr. Yogesh Joshi for his support every time. Let's continue to work together to create a world where adolescent mental health is better understood, supported, and prioritized. Thank you all for joining. Wish you a wonderful evening ahead. Good night.
Good night. Good night, madam.
Good night. Good night.
Thank you.
Shubhratri. Thank you.
Shubhratri. Shubhratri.
Thank you.